David, can you talk a bit about BRI Care Consultation, what it is, the key components, and how it is a comprehensive dementia care model?
BRI Care Consultation is the name of a program that a group of us started working on back in the late 1990s. The BRI stands for Benjamin Rose Institute, because now that program is a program of Benjamin Rose Institute. And there have been 11 completed research studies on this program, and it has evolved over the last few decades. Now it's a mature evidence-based program, meaning it's been proven effective and recognized as helpful in important ways. It's a comprehensive dementia care model, one example of a comprehensive dementia care model, and its features that are in line with the beautiful description Katie provided of what a comprehensive dementia care model consists of. First of all, it pays attention to both the person living with dementia and the caregiver. So, and when I say the caregiver, really, it's oftentimes more than one person, one family member or friend. So it's really caregivers. And it's a program that can focus on multiple family and friends who are helping the person living with dementia, and importantly also include and hear the voice of the person living with dementia. Philosophically, the program was designed for both sides, and especially to realize that the person living with dementia needs to be heard as well, and not only the caregivers. The program also is very individualized. And by that, what I mean is that there's a standard protocol, a standard set of procedures that someone delivering the program has to follow. But the specific kinds of help that the program provides are very individualized to what the person living with dementia and the family or friend caregiver wants. And it is driven by what they want. And that's a very important underpinning for the program. It really is about helping people with the things that are important to them, rather than necessarily just giving them the same help as everybody else. So it's structured, it's rigorous and standardized, but when it comes to how it helps, it's very individualized, and that's an important component. The main things it does, first off, it helps people find, use, and change when necessary services and supports that are available to them. And that might include healthcare services. It might include services from community organizations or individuals who are hired, any type of service or resource. So care consultants deliver the program, and they're a professional. They're often social workers, nurses, or some other person from some other discipline who is knowledgeable and acts as a coach for both the person and the caregiver. Now, sometimes the person's too impaired to participate themselves, and then the care consultant might work just with the caregiver, but ideally for both. The care consultant helps guide the caregiver and the person living with dementia to find the solutions to the concerns they have, especially around finding services and accessing services. It's very confusing to locate help that's needed. It's hard to know where to go first. Even people who are experienced with services it's confusing. We have a very fragmented service system. And the difference between what you get from healthcare services and healthcare providers versus what you can get from a community organization or a community-based agency, those are like two different worlds. So a care consultant is one who knows about both. And that's really important because, as Katie said, the issues and wants and needs of people who are dealing with dementia cover a very broad range of issues. It isn't just a medical issue. In fact, there are certainly as many non-medical problems that are related to this disease as there are medical side of the problem. So, care coach, experienced, knowledgeable, specially trained, and deals with a wide range of issues as far as finding help. The care consultant also provides emotional support for both the person and the caregiver. They establish a long-term relationship. So it's somebody that gets to know the family, who becomes a familiar source of information, understands their situation, and can be there as a source of emotional support because they understand what the family's going through and what the person's going through. And they have a long-term relationship. How long depends on where the program's being implemented, but we like to see it implemented for at least 6 months. And sometimes it can be for the whole journey of the disease, living with the disease, which can go on for years. Another source of help that the program provides is quality information. When we started developing this program, it was hard to find information. There was very little that you could locate yourself. You could go to the library, you could talk to friends and family, you could talk to healthcare providers, but a lot of it had to be done in person. And now there's a wealth of information out there, but we have a new problem. Now the problem is sorting through what's quality information and what's not.
Yeah.
And that's now what the program focuses on. It has an educational resource library of information about any topic you could imagine related to dementia and dementia care. And it's all been vetted and carefully reviewed for quality. And care consultants have that at their disposal. And a lot of times the very first thing they do with families is send them information that they know matches what the family is looking for and is quality information. And that begins a dialogue that can go on for many weeks about a problem and finding a solution to the problem. The other thing that this program does that's really important is it really helps with the entire family and helping families work together better. And sometimes care consultants, as an outside person from the family, can help to guide the caregiver and the person with how to ask other family members to do things a little differently, or maybe to help in ways that they're not currently helping, or maybe to help a little bit if they're not helping at all. And having that outside person there to work and coach caregivers and the person on how to do that, oftentimes very helpful.
This is so helpful to hear more from you about the intervention, how it works. There's so much that we talk about is, person-centered and family-centered, and why not go right to the source? And it sounds like, from what you're saying, that the model allows for changes in real time. So as the needs change, you can adapt and create a new plan and work with the person and the family.